Hi, I'm Bea. I'm your student nurse for today. I'm going to be doing a head-to-toe assessment for you, and that should take about 15 minutes. So I'm just going to do my hand hygiene real quick. And can you tell me your name and date of birth, please?
Angela Guliana, December 6, 1997.
Okay, and I confirm that with her wristband. Okay, good. And can you tell me if you have any allergies?
To seasonal allergies.
And what happens when that's triggered?
I get a runny nose.
Okay, so I would document that in her chart. And on a scale from 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt, can you rate how you're feeling right now?
0.
Okay, great. So moving on to my general survey of her, I'm looking at my patient's appearance. I'm noticing her skin color. It's appropriate for her ethnic background. There's pink undertones in her palms and the soles of her feet. I'm looking for any rashes, wounds, or lesions on her, and I'm not seeing any, which is good. I'm looking at her hygiene, and she's dressed appropriately for this appointment, and her hair is clean, so that shows she's taking care of herself. I don't see any tripod breathing, so she's effortlessly breathing, which is a good sign. Do you know your weight and height?
I'm 5'4" and 145.
Okay, so that is within the normal BMI range. And then can you tell me your name again?
Angela Guliana.
Can you tell me where you are?
Hospital.
Can you tell me what month it is?
April.
And then can you tell me what brought you here today?
Just a checkup.
Okay, so she's alert and orientated times 4. And then can I test your gait? Would you stand up for me and then just walk a little bit across the room and walk back? So here I'm looking to see if she's able to walk and she's not leaning on any side, she's not limping, so it's good. Thank you. So moving on to the skin and nails, I'm going to feel that she is warm to the touch bilaterally, and she is. And then I'm going to test her skin turgor. I'm just going to do a little pinch, and her skin is elastic, which is a good sign. Then we're going to test capillary perfusion, and that means that her capillary should refill within less than 2 seconds. So I'm going to squeeze it. 1 Mississippi, 2 Mississippi. Okay, so she did refill within less than 2 seconds, so that's a good sign. And then looking at her nails, I'm looking for signs of clubbing. There's no ridges in her nails, there's no discoloration, so that's a good sign that she's not malnourished or anything. And then we are going to go on to her head. So I'm observing that all of her features are symmetrical. Her nose is midline. She has no observable lesions, no rashes. So I'm going to touch her scalp and inspect that for you. Okay, and her hair distribution is good. I'm not seeing any dry skin. There's no noticeable lesions or inflammation. There's also no presence of infestation. So moving on to her eyes, I'm looking at her eyebrows. Again, there's good hair distribution. She has eyelashes. The skin on her eyelids are not dry. She's blinking, and it's good. So I'm going to test her pupillary response to light. So shine a light in her eye. Great. Then look forward again. Shine a light. Perfect. Okay, so her perla is intact, and now I'm going to ask you to look forward again. And can you follow this? Perfect. And her eyes do converge as that moves toward her, so that's good. Now, could you pull your hair back behind your ears? Great. So she was responding to my questions earlier, which shows that her hearing is good, and I'm not seeing any hearing aids, so now I'm just going to look inside your ear. And I'm looking for any discharge, if there's any inflammation or any swollen ears in her external ear. Again, there's no discharge, no inflammation. Now I'm going to palpate your ear to see if there's any pain when I touch it. Anything?
No pain.
Great. And here?
No.
I'm also noticing that she has a piercing on each side of her ear, and there's no signs of it swelling or infection, so that's good. Do you work in an area where there's like loud noises or anything like that?
No.
Great. And do you clean your ears?
Yeah, just with a cotton swab.
Okay, so she isn't cleaning the inner canal of your ear, are you?
No.
Okay, good. Perfect. Okay, so moving on to your nose. So her nose, again, is midline. There's no discolorations with it. There's no visible lesions. So I'm going to check the inside of your ear, so if you could just tilt your head backwards. Okay, and there's no discharge in her nose, no inflammation. Now we'll test the patency. So I'm going to occlude one airway and then breathe in and out. Okay, so great. Perfect. So her airways are patent. Now we're moving on to her lips. I see that her lips are pink. There's no cracks in them and they're moist. If you could open up your mouth. Here I'm looking at her mucous membranes, which are pink and moist. I'm also observing the texture of her tongue. The top of it is rough. Could you stick your tongue out for me? Tongue out. Great. And then up. Can you lift it up? Perfect. And then the texture of the bottom of her tongue is smooth. I noticed that her teeth are intact. There's no visible breaks in them. And then her gums are also pink. So, if you could open your mouth and say "ah" for me. Okay, so her uvula rises with phonation, and now I'm grading her tonsils, and they are a 1+. Perfect. Okay, moving on. Now we're gonna do your range of motion for your head and neck. So for this, could you look side to side, and then up and down? Great. And then can you shrug your shoulders for me? Perfect. Now we're gonna test if you could move with resistance, so head side to side. Okay, then up and down, and then shrug your shoulders. Perfect. Moving on to your upper extremities. Again, I'm gonna feel their temperature. They're warm to the touch bilaterally. And we are going to look at the radial pulses. Okay, so they both have a regular rhythm and a 2+ pulse. And then with this, we are also going to test your range of motion. So if you could stick your arms out for me in front of you. And here I'm observing again that her skin is the same color, there are no lesions. She has hair growth, which is a good sign that she's getting perfusion there. And can you lift your arms up to the side? Then like you're in a roller coaster. Great. And then can you bring them back forward? Then can you move your wrists up and down like this? And then side to side. Great. Can you wiggle your fingers? And now I'm just going to palpate to see if there's any joint pain. Any pain when I do that?
Okay.
Great. And I'm also noticing that her joints aren't inflamed. So next we're going to test your range of motion with resistance. So if you could push upwards, push down. Great. And then your arm, hands against mine. Great. And then perfect. Okay. Thank you. So moving on, I'm going to move to her respiratory. I'm looking at her breathing. Again, it looks effortless, so that's a good sign that she's not in any pain when she's breathing or in any like labored breathing. She's not in tripod position. She has a 2-to-1 transverse anterior posterior chest ratio, which means she doesn't have barrel chest. And then we are now going to listen to her lung fields. So I'm going to listen under your shirt, if that's okay with you. Okay, so starting at the top. Can you breathe in and out every time I move? Okay. Then I'm moving to the side. Perfect. And then I'm going to go under. And we're below. Perfect. To the side. Then we're going to move down again. To the side. And then we're going to move down. And then to the side. Great. But if you could just turn a little bit for me. Thank you. And now we're going to listen to her lung fields on her back. So again, starting from the top. Great. And then to the side. Then down. To the side. Then down. To the side. Perfect. And then it's listen on the side. Great. And last side. Perfect. So I heard vesicular sounds in all lung fields, which is good. Next, I'm going to palpate your carotid pulse. So I'm going to start on one side. Okay, so she has a bilateral 2+ pulse that has a regular rhythm. Then we're going to move on to listening to the 5 places of your heart sounds, starting with the aortic point. Pulmonary point. Herbs point. Tricuspid, and then mitral. So at each place, I observe the S1 and S2 sound. And then I would also be listening to your apical pulse, which is here for a full minute to assess that you do have a regular rate and rhythm, which would be between 60 to 100 beats per minute. Okay, so we're moving on to the GI section. So if you could lie down, sorry. And for this, I will have to lift up your shirt. When was the last time you went to the bathroom when you urinated?
About an hour ago.
And did you feel any pain with that? Was there any discoloration?
Mm-mm.
Great. And then when was the last time you had a bowel movement?
This morning.
Okay, perfect. So now I'm going to ask you to lift up your shirt. Okay, so now, sorry. I'm looking at her abdomen to see if there's any discoloration. I'm noticing if there's any lesions or anything. And I do notice that she has a small macule. And have you seen this before?
Yeah, it's a birthmark.
Okay, great. So it's not itchy or anything? Okay, so there shouldn't be any reason to worry about that. So I'm going to start by auscultating, starting in your right lower quadrant and moving around toward your left lower quadrant. Okay, great. So I heard bowel sounds in each of your quadrants, which is good. Shows you are digesting. And now I'm going to palpate your abdomen, and I'm going to feel for any masses or any rigidity in your abdomen. And if there's any pain when I'm doing this, let me know. Okay, great. I'm not feeling anything. So, okay, you can put your shirt back down and sit back up for me. Thank you. So next we're going to move on to your lower extremities, and I'm going to feel for their temperature. They're warm to the touch bilaterally. I'm noticing hair growth, which is again a good sign of perfusion to her lower limbs. The color of her skin is even. There's no lesions, there's no bruises, there's no wounds I can see. Okay, so we're going to test your range of motion here. So could you lift up your legs for me? Perfect. Then put them back down. Then can you angle your feet up, then down? Can you swing them in a circular motion? Then swing the other way. Perfect. So now we're going to test those again, but with resistance. So if you could lift your legs up, great. And then can you pull them down? Perfect. And then with your feet, can you push against me? Great. And then forward. Thank you. Okay. So I would feel for her pedal pulses again, just to make sure she's getting perfusion here. Okay, good. Okay, great. So I'm feeling a regular rhythm with both feet, and it is a little softer than normal, so I would rate it as a 1+ pulse rate. Okay, so that concludes the head to toe exam. I'd lower the bed to the lowest position. I'd lock the wheels of the bed so you don't move around. I'd lift up 2 side rails, and then I'd ask my patient if she needs anything else, if she has any questions for me. Okay, great. I would tell her that the call light is there if you need anything, and make sure it's within her reach. And then I would also let her know that I'll be back to check on her if she needs anything. And then I do hand hygiene and leave the room.